Nearly every day we hear about new breakthroughs in treating breast cancer.
And News 13's Victoria Dunkel is streaming live from the Breast Center at Pardee Hospital in Victoria. That's where some of that research really plays in on a daily basis, right?
It really does. In fact, right now, this center is involved in several different trials involving chemotherapy and other approaches to treating breast cancer. But it all starts with really having a good grasp and understanding of your breast health, and that's where Linda Bryson comes in. When women come in for their regular screenings with their mammography, you're the person they see. But a lot of people have some misconceptions about what that's about. So how do you alleviate some of the fears?
With digital mammography, it has become a much more comfortable exam for ladies. Their largest fear is that it's going to hurt. They've heard stories about how painful it is. But with the technology now, digital has made it much more comfortable for ladies, and also less radiation, and we get incredibly detailed pictures.
And this is just kind of an idea. You use your hand to give the women an idea that this is not going to be an extreme situation. Yes. Not as bad as it used to be, and it's definitely worth it for the peace of mind that comes. But if for some reason you do have a mammography that comes back with some questionable elements, you, under this same guise here, under the same, if you will, roof, are guided to doctors like radiation oncologist. This is Dr. Christy Owens, and she actually works with women and patients who choose radiation for their therapy. But what are some of the options that having this breast center, kind of all-inclusive place, gives patients?
Well, patients, if they have an abnormal mammogram, they will have a biopsy. And depending on what the biopsy shows, if it is a malignancy or even pre-malignant cells, then they will see the breast care navigator, who will then schedule their appointments.
What is the cutting-edge technology that you're using for patients here?
Well, if a patient has a biopsy, there is a study that they can enroll in. And this study is taking blood samples, and we send the blood samples to a company in Texas, and it's a basically tissue banking. And they look at these blood samples, they determine if there are certain chemicals in the blood that correlates with a positive biopsy.
And information from these kind of studies here are what lead to the reports we do almost every day, like I said, where they're saying researchers have discovered a new way to approach breast cancer treatment. And it's because of programs like what's going on right here in our own backyard. Coming up, we're going to talk about the nurse navigator that Dr. Owens just mentioned. Reporting live in Hendersonville, Victoria Dunkel, News 13.